So there are multiple types of ligament injury, and that's one of the main messages that not every ligament injury is the same. So the typical one where you go over on your ankle, you invert your ankle and it affects the ligaments on the outside, that can um, be of various grades. So it can be a minor sprain through to a full ligament tear. And the treatments for those are different. Most of the outer ligament injuries generally tend to be managed without surgery, just for varying amounts of time immobilizing and then physiotherapy. But there are other ligament injuries affecting the central ligaments of the ankle and the inner ligaments of the ankle that may require surgery that are slightly more complex. So I think in terms of how you will know if your if your ligament injury requires surgery, firstly, can you weight bear on it? If you can weight bear on it, if you can't weight bear on it, it's generally something that needs to be seen. And if the pain is predominantly on the inside, or predominantly across the middle and not so much on the outside, then that definitely needs to be seen as well. So there are a huge variety of ligament injuries, some of which need surgery. The vast majority don't. But some things to look out for would be pain on the inside, pain across the front, and inability to weight bear. So like I said before, some ligament injuries do require surgery, particularly the ones where the ligaments connecting the two bones together at the center get injured. They sometimes do need repairing, but the vast majority don't. And then depending on the severity depends on what you do. So with a nasty ligament injury, whereby the ligaments are torn, I generally tend to suggest a patient will go into a boot for 2 weeks or so, allow everything to gum up in the right position, and it's helpful for pain relief as well. And then to go into a brace and start physiotherapy. I think the message that you can't treat every ligament injury is the same. There's a very big difference between a sprain or a stretch of one of the ligaments to a complete tear of all ligaments on the outer part of the ankle, and one would return back to sport within a couple of weeks, and one can take 3 to 6 months to return back to sport. So I think the message is that every ligament injury is treated individually. Absolutely. So a standard ankle sprain doesn't need a cast or a brace, but the more nasty ones might require a short period of time. I don't tend to use casts. I tend to use boots, boots or a brace, but certainly they can heal without anything. But a boot will be in the right type of injury would help in terms of holding everything in the right place and stopping the ligaments from being healed, stretched, such that the long-term recovery is better. So with a torn ankle ligament in an acute stage, so say you've had a nasty tear to the ligaments on the outer part of the ankle, I generally tend to do a boot for 2 weeks, fully weight bearing, and then a brace for 2 weeks and start physiotherapy. And then it can take 8 to 12 weeks with physiotherapy to get back to full sports with a severe ligament injury. The ones that need surgery, and I tend to do that in the elite athletic population that depend on their ankle for a living, and also they have a slightly lower risk of having chronic instability. And the other ones I repair are the ones that have done 6 months of physiotherapy and they still have instability, which is about 15% of patients. In those patients, once they've had their ligament fixed, what I tend to do is 2 weeks in a half a plaster, whereby they're not putting any weight on it. And then I do 2 weeks fully weight bearing in a full plaster, and then 2 weeks in a boot. So after 6 weeks, you're out of everything and starting physiotherapy. So I think the main things to look out for are firstly inability to weight bear. So if you can't put your foot down and it's too painful, then that probably needs to be looked at. Secondly, if the majority of the pain is across the front of the ankle rather than on the outside, they do need to be looked at. Or if the pain travels high up, so high up towards the knee. And the other thing is pain predominantly on the inside of the ankle. All of these things can indicate a slightly more complex ankle sprain. And if you have an inversion injury, so the ankle goes in and you've only got pain on the outside, you're able to weight bear, there's no tenderness on the bone, and you've got a full range of motion, then that patient may not need to be seen, but anything else, as mentioned before, will need to be seen.